Hello everyone, welcome back to our evidence-based radio clinical channel where we regularly see interesting cases. Today we are going to see a case of hepatic hemangioma and imaging modality we choose for today's study is TPCT CT scan and ultrasound. Today a 32-year-old patient come with complaint of pain in abdomen since 14 days with no history of fever, jaundice and melena. On ultrasound there is a hypoechoic lesion present in her liver. So we do TPCT scan in this patient to rule out what is the lesion. In non-contrast phase, we see a rounded, homogeneous, slightly hypoattenuating relative to liver parenchyma in segment 6. Sometimes it's difficult to diagnose hepatic hemangioma in non-contrast phase due to its very much similar attenuation with liver parenchyma. Now, in early and late arterial phase, we can see this rounded lesion show peripheral nodular enhancement. Small lesion may show uniform enhancement, but here we can clearly see fairly defined rounded lesion showing nodular peripheral enhancement in segment 6 of liver parenchyma in right lobe of liver. In late arterial phase, we can see here that this filling and enhancement become more progressively more and a thick band of enhancement we can see, but still in the central part there is a hypoenhancement. In portal venous phase, as we see here, the progressive filling is more and almost completely fill this lesion centripetally in the segment 6. And in further delay phase, we see there is almost completely fill this lesion, and in delayed phase, this lesion does not show wash out. Now let's see in the coronal plane, we can see this is the earlier arterial phase where a peripheral nodular enhancement we see. In the late arterial phase, we can see this enhancement become more thicker, and in portal phase, sorry, in further hepatic venous phase, we say this is almostly completely filled with contrast and show enhancement. And this lesion does not show contrast washout in its delay phase. This is the characteristic of it. Now let's see ultrasound image of this picture. In ultrasound, hepatic hemangioma appear as a well-defined hyperechoic lesion. Sometimes in this hyperechoic area, a small area appear as hypoechoic, which may be due to the background of hepatic steatosis. So this is a case of hepatic hemangioma, which characteristically show early arterial peripheral nodular enhancement. As we see here, this in early arterial phase. That progressively becomes centripetal filling and enhancement persists, that is contrast not wash out in delayed phase. If we differentiate it with hepatocellular carcinoma show arterial phase enhancement and early washout. If we compare it with metastasis show enhancement in rim with no or minimal centripetal filling. While in case of abscess, we see thick irregular rim in the lesion and other clinical signs present such as fever. Hepatic hemangiomas are the most common benign vascular lesions and more commonly located in periphery of the liver. So question is arise here why it so no washout, since this is a made of large dilated vascular channel like sinusoid, so it act like reservoir of blood. So when contrast come here, it get trapped inside the spaces and blood flow in this area is low and sluggish. So in this reservoir, it not get contrast not get clear quickly. Since this are benign lesion, so no active intervention required. We generally do the follow up to see any change in size, shape, or its character. So this is our today's hepatic hemangioma case. Thank you for watching. Have a great listening. Never forget hepatic hemangioma so not so wash out. Thank you.